Chances are you are taking at least one prescription medication right now, or you just finished with dinner. Yeah. And the odds are even greater that you paid more than this time ever before.
In fact, prices for the most popular brands of drugs have risen over 200%, much more in some cases since 2008. The reasons are varied. The arguments over how to cut drug prices are all over the board right now, from your living room, of course, all the way up to Capitol Hill. But one Memphis man is quietly changing the way those who can least afford the best in health care manage to get the medicines they need. You would never know it watching him caress the fretboard. But Gospel Music Hall of Famer Tommy Cathey is in pain.
When I was first diagnosed with rheumatoid arthritis, the pain was so bad, it was almost impossible to play my bass.
Earlier this year, his doctor prescribed a new medication.
Leflumenide. That's a 3-month supply.
The new meds work wonders, but the price does not.
If I'd have got this at any other regular pharmacy, it was going to cost me about $600.
Then he found Good Shepherd Pharmacy. What does it cost you now?
$101 for 3 months.
Well, that's 85% savings.
Yes, it sounds too good to be true.
We found this wonder pharmacy. Tucked away on the 3rd floor of a blank brick building in the medical district, Good Shepherd Pharmacy is changing lives one mail order at a time.
And our biggest problem for the first 3 years has been that people say that's too good to be true.
Meet pharmacist Phil Baker.
We opened September of 2015 with about 200 medications that were free for people who are low income and uninsured. In our first 3 years, we have recycled or reclaimed and redispensed over $12 million worth of those meds, that would have otherwise ended up in the landfill.
A membership to Good Shepherd Pharmacy is $40 for an individual, $70 for a family. Phil sells drugs at cost or below, and sometimes even gives them away.
So the markup on prescriptions, people know it's bad, but they really don't know how bad. A really good example of that is clopidogrel. Clopidogrel is generic for Plavix, which is one of the most commonly prescribed blood thinners in the country right now. Right. 30 of these things at a regular pharmacy out in town will run you anywhere from $50 to $250. The cost on those, what we sell them for, is less than $1.50.
That's for a 30-day supply?
For a 30-day supply.
$1.50?
Yeah.
There are no opioids on these shelves, no drugs that require a federal license or oversight. All the drugs are either donated by pharmaceutical companies or by people through an unprecedented donation program. To Phil's knowledge, Good Shepherd, which has 501c3 status as a charity, is the only pharmacy of its kind in America. The only money made is through the memberships, not on the drugs. And sometimes that's still not enough.
And there was even a period where I didn't have enough money to pay my employees for like 6 weeks. And nobody quit. Nobody ever quit.
Do I pay my medicines or do I pay my rent?
Mary has been a customer and a volunteer at Good Shepherd for more than a year now.
This is a ministry. And God bless him with the vision of Good Shepherd. And I'm a true believer.
And so is Tommy Cathey.
I'm not ready to stop. I want to keep playing. And they afforded me the opportunity to be able to continue playing my bass guitar.
And play he can. Now, Phil Baker wants to take the Good Shepherd model region-wide, nationwide eventually. He also has another dream called Remedy Chain. Remedy Chain would make cancer drugs left over from treatment available to patients in need at a drastically reduced cost. Keep in mind, some of those drugs cost from $50,000 to $250,000 for a complete round. Now, if you'd like more information on Good Shepherd Pharmacy and their mission, log on to fox13memphis.com. Click on this story. We've got a link to their website where you can learn more.